Hello and welcome. I'm Dr. Adam Dorsey, a psychologist in Silicon Valley, and I am the host of Super Psyched, a podcast dedicated to supercharging your life. Each episode contains fun, high-quality interviews with experts looking at psychology from all angles. Super Psyched is your tool to get more of what you want in your life and less of what you don't. Chronic pain can seriously alter the quality of a person's life. And sadly, chronic pain is prevalent in the United States, with more people suffering from it than the total diagnoses of cancer, diabetes, and heart disease combined. When the source of pain can be diagnosed and treated, it is a relief. Yet far too many people have pain without a diagnosable, treatable, physical root cause of their pain. Their experiences can be lonely, which can cause or exacerbate symptoms of depression and anxiety. Why are so many people suffering, and what can be done? And how might a psychologist be able to help? On this episode, you will hear answers to these questions from physician Dr. Howard Schubiner, clinical director and co-founder of the Freedom from Chronic Pain program. Freedom from Chronic Pain is a structured online pain management program and has been effective for people suffering from various types of pain, including back pain, migraines, fibromyalgia, and many others. Howard is also the author of several books for both laypeople and professionals, including a very popular self-help book called Unlearn Your Pain. He has also authored over 60 publications in scientific journals and has been consistently named one of the best physicians in the United States. So please join Howard and me as we discuss how to unlearn your pain. Dr. Howard Schubiner, who has asked me to call him Howard, welcome to Super Psyched.
Thank you so much, Adam. It's a pleasure.
Oh, I'm so happy to be with you. Just a little background. I heard about you from my cousin Andrea, a psychologist, who mentioned you really helped enormously in her life. You were under the tutelage of someone who helped me quite a lot, Dr. John Sarno, the author of Healing Back Pain. I loved your Google Talk and a whole host of things that you've done. And one of the things that you mentioned is that the number of people suffering chronic pain is currently at an all-time high, outnumbering people suffering from heart disease, diabetes, and cancer combined. What is going on, and why is it so high now?
We have an epidemic of pain. It has risen. It's not that it's always been that way. It actually has risen. The incidence of back pain, or the prevalence, I should say, of back pain in this country has actually doubled in the last 2 decades. I mean, that is shocking. What, is our backs have changed? I really don't think so. Teenagers never used to have back pain, because I'm old enough to have been a doctor for almost 40 years. And young people didn't get back pain. And now 1/3 of teenagers have reported back pain. And what's interesting is that teenagers are also, and adults are also experiencing rapid rises in anxiety and depression. Guess what? These things are all correlated. It's not a coincidence that these things are happening.
So one of the things that you disabuse the public of is that in spite of the fact that the physical abnormalities in our body are not necessarily the root cause of our pain, and that it exists in our brain, you're saying it's not just in your head. It's not that we are crazy, but these underlying anxieties and mood disorders such as depression exacerbate and perhaps even cause these pain symptoms. Is that correct?
Right. Yeah. I mean, it's shocking. It's a fact. Go to my grave saying this. It's a fact that most chronic pain is non-structural. I mean, this is a shocking thing, okay? Because, but it's true. And I'm a physician, and I would never, ever want to miss a structural problem. Never, ever. But when you talk about people with headaches, for example, every neurologist knows that 95% approximately of people with chronic headaches don't have a structural problem that's causing their pain. No tumor, no infection, no vasculitis, etc. When you take people with irritable bowel syndrome, the most common cause of abdominal pain, there's no structural problem because by definition, you've ruled out Crohn's disease and ulcerative colitis and ulcers, etc. And with fibromyalgia, there's no evidence of a structural problem in the body. And the same with chronic pelvic pain syndromes. When you get to back pain and neck pain, it gets tricky because people all know that there must be something wrong with your back or neck when you have chronic neck or back pain. And we all know that your MRI is going to be abnormal. But as Dr. Sarno pointed out a long time ago, and it's been held up and verified scientifically, most people have abnormal MRIs of their back and neck without any pain, degenerative disc disease, bulging discs, etc. And we just completed a study where we evaluated over 200 people with chronic neck and back pain. And by using our careful criteria, which I can tell you about if you want, we determined that 85% of them did not have a structural problem, which kind of fits because the other chronic pains, the headaches, the stomach pain, the pelvic pain, the fibro pain, are also non-structural for the most part.
And that dovetails perfectly with my own reality. I had an MRI taken of my back in 2002, and the pain I was experiencing was supposed to be predominantly on the left. Well, it was actually presenting predominantly on the right. And the pain started as soon as I learned that my father-in-law was moribund, and it was just weeks before our wedding, and I didn't know what to do with those feelings. There were so many of them, and I was not walking well anyway for 6 whole months, and those symptoms did not go away until I engaged psychotherapy, and the symptoms remitted after I processed some of those thoughts and feelings associated with it. I'm so delighted with what you're doing. You mentioned the idea of, I will go to my grave saying this. And what I can only infer from that is that there are probably some naysayers out there that maybe, in addition to the fans that you have, that maybe there are some people who are staunchly against what you're trying to propose with what you've termed mind-body syndrome, used to be referred to more as TMS, I believe.
Right.
But I was wondering if you could speak to that phenomenon of just some of the resistance you may encounter and how you deal with that.
For sure. We just published a paper. We think it's a landmark paper in JAMA Psychiatry just a couple weeks ago now. And we had 150 people randomized trial into 3 arms. And we had fMRI of their brain going on, all sorts of high-tech stuff at the University of Colorado Boulder. Tor Wager, one of the best neuroscientists in the world, supervising this study. And the people that we treated in the mind-body arm of this randomized controlled trial, of the 50 people that were randomized, I evaluated 45 of them. Of the 45 I evaluated, 43 had non-structural chronic back pain. Their average duration of pain was 10 years. 10 years, average duration of pain, chronic back pain. And yet 43 out of the 45 I evaluated, using my criteria, did not have a structural problem in their back. And of the people we treated, 75% were pain-free in 1 month, Adam.
Unbelievable. Just 1 month. And after all of those repetitions of neurons firing together and wiring together, all of those grooves of the mind-body connection circulating for 10 years, and you were able to help them unlearn 120 months ostensibly of learning in just 1 month.
Exactly. And that's the power of the brain. And so how do we do this? You know, you have to love people. You have to care for them.
Yes.
Right. You have to show them that you're not blaming them. You're not saying they're crazy. It's not all in their head. It's not that they're weak or deficient. It's not that they want the pain. It's not their fault. That's 100%. And you really have to hammer that home. You really have to show people that, because people don't understand. There was an article published in the Washington Post just last week on our treatment and on our study. And you should see the letters to the editor that came rolling in. Their hatred and vitriol. They're just assuming that we're saying that it's their fault or they're crazy or it's all in their head. And that's not the case, because this is the revolutionary thing about the brain. And most doctors are unaware of this. And I was certainly unaware of it until about 10 years ago even, is that our brain creates what we experience. We don't see with our eyes, Adam. Light comes in our eyes, but our visual cortex creates the images that we see. And our brains can create stuff that's actually not there. Like my Apple story. Let me just tell you this quick Apple story for a second. Okay.
I love the Apple story.
My wife has the same breakfast every morning, sliced apple, yogurt, granola. And one morning she got up early and she had an extra slice and she brought it up to the bedroom and she fed it to me. I didn't see it. I didn't touch it. It was dark. And I took a bite and I got this rotten taste in my mouth. And it turned out she had a peach that day, not an apple. And the peach was sweet, but it was soft. And my brain was predicting crunch of an apple. And my brain therefore alerted me like a smoke alarm that there was something wrong. And my brain took that sweet taste and created a rotten taste. And the back pain that you were having back in 2002 was not caused by a disease in your back. It was caused by the danger signal in your brain that alerted you. And it was not because you were anxious or depressed. It was just a danger signal that you didn't know how to handle this horrible situation you were caught in with your marriage and your father-in-law's illness or demise.
Yes, exactly.
And your brain has to send a message. I mean, that's what it does. When you are injured, the same part of the brain is activated as when you're emotionally upset. It's the same thing. So that pain is real because all pain is real. All pain is generated by the brain, either in response to an injury, physical injury, or in response to an emotional injury. And that's what this neuroscience tells us. And once people can really understand that, it will revolutionize our understanding of chronic pain.
I love the peach story because you like both peaches and apples, and yet your expectations were not met. There was no crunch and it tasted very different from what you were expecting. And your brain in that split second in the moment couldn't somehow reconcile that you were expecting this, but got that. And I think that that is apropos of our discussion around pain. How is that consistent? How does that present itself, for example, in a person who might be suffering from pain? How might expectations or other neural signals be causing or exacerbating pain?
So this guy who I met was in the Vietnam War as a young man. He got injured, shrapnel wound. There was a lot of guys died, a lot of gore that day. He got medevaced out on a helicopter. So he had pain. He had a lot of pain and he had an injury. The reason he had pain was his brain turned on pain. Not all injuries cause pain. There's a great study by Henry Beecher from World War II where he showed that 2/3 of wounded soldiers did not have pain, even though they were wounded. So pain is a decision the brain makes. And this is a fact. And again, it's shocking and revolutionary. But in this guy had pain. His brain turned on pain. Usually it does when you're injured, of course. And his injury healed because all injuries heal. And then his brain had to decide, okay, will I leave the pain on or turn it off? His brain turned it off. So he was fine, pain-free. 20 years later, he's walking down the street and all of a sudden he gets the same pain in his leg he had 20 years earlier. And 2 seconds later, he notices this helicopter flying up behind him. And it turned out the helicopter had triggered the neural circuits in his brain that had learned pain, remembered pain. And so the pain was due to a neural circuit. And what happens is when our brain is expecting pain, if you're having pain when you bend over, your brain is going to likely expect pain and therefore create pain every time you bend over. That's a neural circuit, and that can be changed if there's no damage to the back, because the back is healed. You had an injury, the back healed, but now the brain is continuing to activate these neural circuits. And that's why those people in that Boulder study could get better so fast, because the problem wasn't in their back. The problem was these neural circuits.
I love that story, not for the sake that he suffered, but because it's so edifying and so relatable. I believe that the back pain I was experiencing was definitely connected to something that had occurred prior in my life that I hadn't reconciled. And the stimulus of this storm headed my way of my father-in-law dying just before the wedding. We actually got married in front of his bed, but was in some way connected to something in my past, in as much as the pain of this vet experienced something connected to his past, it with the stimulus of the helicopter sound.
And sometimes we see that very powerfully, amazing. There was a woman I saw who had 17 years of head pain, 17 years of daily chronic headache. And it started when she got a new pair of glasses. Well, they tried to fix the glasses, different lenses, et cetera, et cetera. When you get a new pair of glasses, your eyes have to adjust, but it wouldn't cause pain for 17 years. And so I asked her what was going on in your life at the time you got those pair of glasses. And she said, well, everything was fine. You know, my husband, my kids, and, you know, I had this new boss and he would just kind of go off and yell at me sometimes for no reason. And I said, well, has anything like that ever happened to you in your past? And she stopped for a moment. And she said, my dad would have times. He would come home sometimes and he would be just upset and he would just yell and scream right in my face. And I never knew when it was going to happen. And Dr. Schubiner, do you think that might be connected? Her danger signal was going off royally, so to speak, with the new boss, because it also triggered the danger signal from her childhood. And again, you can't prove that, granted. But what happened is that the pain occurred with the new pair of glasses, but then the pain continued because of these neural circuits that continually got reinforced day after day because of her fear of the pain, focus on the pain, frustration with the pain, worry about it, trying to fight it, trying to go to all these doctors and not getting any help, going to different headache clinics and 20 plus different medications. And I'm happy to report her pain went away in about 2 or 3 months. Changing her brain, her pain went away in 2 or 3 months after 17 years. It's just unbelievable.
And so, in a manner of speaking, one of the ways that the diagnosis of the cluster of symptoms that you describe as MBS, mind-body syndrome, previously referred to by Dr. Sarno and for many centuries prior, I believe, TMS, which is difficult to pronounce. You made it far more accessible to the masses by calling it mind-body syndrome. It sounds like one of the ways that the diagnosis itself is confirmed is, do the psychological techniques of attending to it reduce the symptoms?
We have a lot of techniques that we can use with the symptom. For example, we don't want to know, well, do you have pain or not? We want to know where it is and when it happens and when it occurs and what triggers it. Is it worse with stress? Is it worse with the weather? Because weather doesn't actually cause pain. Is it worse with cold or heat? Does it go away when you go on vacation? Does it shift? Sometimes it's in one side of the back and then other times it's in the other side of the back. So we have all these different methods of investigating it and gathering evidence, because people don't really want to be told something. They want to be shown something, and we can demonstrate if you take time and you talk to people. And for example, I was just seeing a lady this week and she was having pain with bending forward, bending her back. And I asked her to stand up, close her eyes and imagine bending. Guess what?
She had pain.
Yeah. And we're like, okay, why is that? You weren't actually bending. Again, our brain creates what we experience. And in this case, it wasn't her back. It was her brain. And now when she sees that, now we have this entree. Now we have this ability to help her be relieved and released. And she started to cry. She started to cry out of release. Oh my God, I've been suffering. Oh my God, I've had this pain. And again, I repeat, the pain is real. The suffering is real. It's not imaginary.
It sounds like you are really conscientious about making sure people know is that the pain is real, that the pain sufferers are not being willful. They're not lingering or seeking secondary gains, that this is actually happening. And it's not their fault, but it's their responsibility, I guess, would be a fair way of saying that they need to find a way to attend to it. Would that be consistent?
Yeah. Everyone knows if you get embarrassed, your face turns red or your chest turns red. This is a physiologic response your brain is creating. Everyone knows if they have a stressful day, they might get a headache. Everyone knows if they go on a podcast with a famous person like Adam Dorsey, their stomach is going to be maybe tied up in knots or whatever, right? Everyone knows that. These are just normal human reactions. And what I say to people is, the problem is you're just human. You have a brain, you have a body. Everyone has these mind-body reactions. Everybody does. And just in some people, because of a variety of reasons, it begins to turn chronic because of maybe over-focus, over-fearing of it. Frequently, the medical profession, God love them, they create or they have misdiagnoses, what I would say, or inaccurate, where they're attributing the back pain to these degenerative discs, even though we know that everyone has degenerative discs and that's not the cause of pain, or they're giving people a name that sounds scary, like chronic fatigue syndrome or interstitial cystitis or coccydynia or fibromyalgia, all these names. And people look it up, of course, and they go online and what do they find? People don't recover. It's chronic. And then they get more and more afraid of it. And that triggers these neural circuits to get worse over time. And so we're fighting kind of an uphill battle in a lot of ways, because there's a lot of forces telling people that the medical profession has the answer for these things. And as a doctor, I love the medical profession. And we've done incredible work with diabetes and heart disease and cancer. And we're doing amazing stuff, in this area of these chronic conditions for which we can't find a medical explanation. We need a different way. We need a different approach.
So I'm just thinking about a patient who saw me shortly after a breakup. And one of the things that he told me was that he was experiencing idiopathic, that is unknown cause, testicular pain.
Yeah.
And after just a few sessions, he ended up going home. And he said on his way home, he noticed that the pain was gone. He left me a voicemail. He said, I can't believe it, but my pain is gone. And it never returned. And what we came to recognize was that this idiopathic presentation of testicular pain was in all likelihood a symbolic somatization or somaticizing of how he felt kicked in the nuts by the end of the relationship. And I was wondering, you've described this yourself about people who have pains in their butts because they've been around somebody who was a total pain in the butt for a long period of time. I'm wondering, how can people maybe zero in on the symbology of their pain?
We see that a lot, and it's kind of fun to think about. Pain can be symbolic, pain in the neck, thorn in the side, can't stand this, your feet hurt, I can't stand that in my life, or this makes me sick in my life, and they may have nausea, for example. But pain can also be contagious. It's not always symbolic. Pain can be contagious. This is so kind of freaky, but you can read about something or have a friend have something, and your brain can latch on to that. Okay.
That is so massive, and it's consistent with my own experience. Can you please elaborate on the contagious nature of pain?
There was a study in Germany where they had started looking at the prevalence of back pain in East and West Germany after the fall of the Berlin Wall. At the beginning, the prevalence of back pain was much higher in West Germany than Eastern. And over time, those people began to meet each other and connect and commune because the wall was down and the border was open. And over the next decade, the prevalence of back pain in East Germany rose to the level of the prevalence of back pain in West Germany. And the conclusion was back pain is a contagious disorder, from West to East Germany. That's data. And I mean, it's amazing.
Well, what blows my mind about that is I would think that the people in East Germany, given the constraints on their lives and the just injustices that they suffered regularly, would contribute to, obviously their depression and more back pain. And yet there was a higher incidence of back pain in West Germany where people had freedom. And so I'm actually a little bit by that.
There's something called the Eastern European paradox. And they found not only did back pain change, but heart attack rates in men went up in formerly communist countries that became capitalistic countries. And it can be kind of summed up by, in the old days, there's only 2 TV channels, but everybody had them. Now we've got 100 cable channels, but you can't afford them. It's inequality also. A lot of this is inequality. And in the old days, particularly the men had much harder time adjusting because now they had to fight for it. They had a job. They had their job. Everything was stable. And now it's like, oh, I don't have a job anymore, or I've got to advance, or I've got to compete. And a lot of the ills of our society, a lot of the tribalism we talk about now, et cetera, has to do with injustice and perceived injustice, economic, racial, gender, et cetera. And the perception of inequality, because now we've got the lives of the rich and famous. That's our,
that's our,
yeah, but
right.
People aren't living the lives of the rich and famous, and people are working 2 and 3 jobs to survive, et cetera. So that kind of stress. And as I mentioned earlier, we've had soaring rates, not only of pain, but anxiety and depression in our society.
One of the side effects of living as we do incurs social psychological phenomena of things like FOMO and social comparison, which we know are quite deleterious to our bodies. It involves things like Schadenfreude, taking pleasure in other people's pain while reading about what movie star who seems like they got it all is suddenly going down the tubes. And these are not good for us. So I'm just thinking about how these could lend themselves, and perhaps just the pressure to keep up with the Joneses is so big. And I guess the question that you and I are clearly not going to be able to solve during this talk is, how do we keep the freedoms of a wonderful democracy while simultaneously reduce the perceived pressures?
It boils down to safety or danger. And that comes back to neuroscience. And so when people feel endangered in their lives, particularly when they feel trapped, the danger of the threat detection system goes off. And our threat detection system is everything. I mean, it's operating all the time. It's why we need it. It's why we get pain when we break an ankle. It's why we don't run into traffic. It's why we freak out when our kid starts walking toward the street. We have this threat detection system, and it's very important. And it goes off when we feel endangered. And when we feel chronically endangered and not safe in our lives, something's going to happen. We may start getting insomnia or fatigue or pain or anxiety or depression. And our job is to help people feel safer. I mean, that's what you do, right?
That's what we do.
Feel safer in their lives. I help people feel safer in their bodies, because I'm helping them understand what's going on in their bodies, and so they can stop the incessant focus and worry about their back or their stomach or their head when they don't need to worry. And then we can focus on helping them feel safer in their lives, emotionally speaking, psychologically speaking, socially speaking, set boundaries, deal with whatever they need to deal with so that their brain feels safer. And when that happens, things happen like to your guy whose nuts stopped hurting, you know.
That's such a great point. And I'm just thinking about so many of the mindfulness-based practices that you endorse that increase activity to the parasympathetic, which is the rest and digest system of the autonomic nervous system, as opposed to where we tend to live, which is more in the sympathetic, which is the fight, flight, or freeze place. You mentioned also that psychologists need to take a greater role in pain management as a thing. I was wondering if you could speak to that.
Studies show that about half of the people who seek counseling have some kind of pain problem. And psychologists and social workers and other counselors, right, feel comfortable helping people with things under their purview, such as anxiety or depression. And why do they feel comfortable helping them? Because those are conditions caused by the brain. Those are conditions caused by their psychological and social situations, right? So that's what they do. But what if their pain is also in the same category? If they have chronic headaches or stomach pain or back pain, and it's determined that these are not structural problems, which is relatively easy to do. If they're determined they're not structural problems, then guess what? What kind of problems are there? They're problems caused by the neural circuits in their brain. They're problems, again, coming back to psychological social situations that psychologists and other counselors can help, can fix, actually, because it's the same. And you'll see, and I'm sure you see this, whereas someone may have, you know, their neck is really hurting, and then the neck gets better, and then their anxiety gets worse, or their anxiety gets better, and their neck starts hurting. And so you're seeing that these are interchangeable in a way. And when you see that, then you have the proof and the evidence that, yeah, it's caused by the same thing. And so we need the same mechanisms of the kinds of counseling that you do and that we're doing to help people reverse those.
That's brilliant. And you were describing kind of a whack-a-mole scenario where something presents as something remits and vice versa. And I'm wondering if you could just also speak to the idea of what would be your laundry list of arrows in the quiver of the pain sufferer. What are some of the things that can reduce the symptoms of mind-body syndrome?
So what we do is we just have a stepwise approach. And the first step is sorting out what's going on. Is this a structural problem that you need more medical treatment? Do you need your hip replaced? Some people do. Do you need back surgery? Some people do, because they've got disc that's actually damaging the nerve going down their leg. But if they have just chronic back pain, not in the leg, chronic back pain, and the diagnosis is degenerative disc disease, chances are they don't need more medical treatment. And that's what we do. So the first step is getting the diagnosis right. The second step is educating ourselves and themselves about pain. One of the things I have is I have these 6 animated videos, and they're short, like 5-7 minutes, and they're just animations, and they explain this revolutionary, complicated neuroscience of predictive coding that our brains create what we experience in cartoon format. And so, there's lots of ways. And like you say, Dr. Sarno's books are still selling 5 years after his death at age 95. Lots of other people have written books. I've written books. There's a lot of information out there, a lot of great websites that I can point people to. So educating people about the true nature of the pain or the other symptoms. And then the third step is reducing fear. The third step, and there's a lot of techniques and ways to reduce fear, and they have to do with telling ourselves the truth, because the truth will set you free. Gloria Steinem said, the truth will set you free, but first it will piss you off.
For sure.
If the truth is you're not damaged, then you need to start telling yourself you're not damaged. You need to start acting like you're not damaged. You need to start moving and bending and walking and living your life as if you're not damaged. And you need to calm your brain and make your brain feel safe through things like mindfulness and meditation, through things like, which sounds silly, as affirmations of self-talk, and stopping the frustration and focus on the symptom. I tell my patients what I do is silly, but it's like you need to live more, laugh more, and love more. That's a prescription for making your brain feel safer and better and happier. And when you do that, guess what? You feel better. And if the pain is due to your brain in the first place, that's all you need.
I'm going to just comment on a few things. First off, during that aforementioned period in my life, I went to a neurosurgeon, just so excited about the possibility of having my parts replaced. And thankfully, he looked at me and said, "You are not a candidate." And I was so upset by that. I was just crestfallen. And I love surgery for what it does. It's an incredible medical advancement. It changes people's lives when it's indicated. And yet, had I been under the knife when it wasn't, that could have been really bad. I'm also thinking about something else that you just said, and that is around humor. Let's just talk about that for a second. Oh, before we actually go to humor, I actually just wanted to comment on the idea that affirmations are silly, and I can understand where you're coming from. And yet, if we look out in nature, what do cats do? They purr to self-soothe. And what do humans do? Well, we're far more verbal. And of course, hugging has been shown to release our endogenous healthy hormones that are conducive to our feeling safe, to your earlier point. And I think the really good little chemistry set to attend to just by hugging and feeling loved and feeling contained. But I'm wondering if you could speak about humor, because I know you and I both share a love of it. And I'm wondering how humor may disrupt pain.
Humor, first of all, it's connecting. So if you studied humor, you'll know that most of the time when people are laughing in a conversation, nothing funny has actually been said. Interesting.
Yeah.
The connection. People use humor to connect, to reach out, to reach back. So connecting and humor are two really important things that make people's brain feel safer, because you're connecting to each other. You're, in a sense, intimate with each other. You're intimate. You're in on the joke. You're in on the love that's happening between you. It's really powerful thing. Humor can be used in cruel ways where it divides people, obviously, but good humor is connecting, and it's changing the neural circuits in the brain out of this danger mode into this laughter and safe mode and freeing mode. We found that to be a powerful way that people's brain changes. And when we get people to calm their brain and soothe their brain, like you were saying with purring or affirmations, and we get people to start moving and without fear, and we get people to start laughing and connecting and loving, these neural circuits in their brain, the danger signal turns off. And then they say, gee, I'm not having the pain right now at this moment.
No.
Why is that? It's just turned off. Why did it turn off? Because we just changed your brain. We didn't change your body in the last 5 minutes. We just changed your brain and it turned off. Oh, now it's back again. Good. Your brain turned it on again. Now we know.
And I believe that smiling can actually release endorphins. And your note to the idea that when people share laughter, they're not necessarily sharing laughter over something that's funny. They're just connecting. And it's such a spiritual thing. And I think about that paired with the healthful benefits of merely smiling. And I like that you contrasted perhaps other forms of humor. I was inferring that you might be speaking about sarcasm and perhaps even roasting, which is bring on the pain, and sarcasm, which shares etymological roots with the, I believe it's the cutting of flesh or something like that. And
bullying. Humor is used in bullying because you're laughing at someone as opposed to laughing with them. And so
totally,
that is a really powerful thing. And people often feel bullied in their lives. And oftentimes, I'm sure you're aware of this, people bully themselves.
So true, through their self-talk and through their self-shaming messaging. Yeah, it's amazing how many messages we convey to ourselves in the course of a day. I often describe self-talk as being akin to a Google search within our brain. So if I lose my keys and I can't find them and I say, how could you be such a schmuck? I will find a million results that confirm the idea that I was a schmuck at various times in my life. Not a very good question to ask myself, but I say, where did I see them last? Or who can I ask? Maybe a better question. And you're talking about shaming language. I was wondering if you could bring that up. What are some of the smoking guns there? And how do people do this to themselves? And
well, that's
math as a virtue.
Right. Well, as you point out, that's why I say, well, affirmations are silly, Saturday Night Live and all. But the bottom line is that if we are talking to ourselves all the time, we just may not be aware. And so the messages that we give ourselves often have been learned. So where have they been learned? So when someone says to themselves, you're a schmuck or you're a loser, I saw a kid just this week with that, he was just beating himself up unmercifully, self-criticizing all the time. And it's, well, gee, whose voice is that?
Mm-hmm.
Where did you learn this? Let's think about this. You were born being so self-critical? I don't think so. So where did this come from? So that gets into some of the hurts or criticisms that people have gotten that they've internalized over the years, particularly starting in childhood. And that's where shame starts. And, it's a very, very important and powerful mechanism that we do to ourselves. And if we don't address that, then our danger signal is going to keep going on all the time, every day in our regular environment, in our work, in our family and everything. If we're constantly criticizing or shaming ourselves, it's setting off that danger signal. And then people are going to, at some point, that danger signal is going to flip into pain or fatigue or insomnia or anxiety or depression.
I've often tripped on the fact that mentor and tormentor rhyme. And I've had a boss who was a mentor and a boss who was a tormentor. And I think that we often imagine virtue as we blame ourselves or shame ourselves or criticize, that this will bring out our best. And I think that we need to reduce our inner tormentor and increase our inner mentor. I mean, where's Yoda and Mr. Miyagi? Let's get those voices in.
Right. Well, those reactions were probably adaptive at some point.
They were a great point.
Right. So the people pleasing kind of thing, if you were criticized, or if even your sibling was criticized heavily and you didn't want to rock the boat, you wanted to be perfect, you wanted to not get criticized, you would start to be on guard and watch out and be hypervigilant and always be pleasing and put yourself last. I've seen so many people who they had to be good and perfect because if they weren't good, bad things would happen in their family, or they would be the one who had to try to solve the problems. They would be the negotiator between their parents who were arguing. And so you learn that, and you learn that you always have to be the pleaser and the fixer and the negotiator and the mediator your whole life. And after a while, it's too much, and your brain's going like, hey, wait a minute, what about me? What about me? Where do I fit in? Do I count? Do I matter?
I think that's brilliant. Behind every strength is a weakness, and behind every weakness is a strength. And behind long-term adaptation techniques and coping strategies, they may outlive their usefulness and may actually become harmful. And I think that you're spot on in recognizing how they've served us during a period of time, kind of the way I imagine you're familiar with Gabor Mate's work. It's like, wow, I'm glad I did use that. And now it's anachronistic. And now it's actually not just anachronistic, but even harmful. And how do I somehow substitute something else? It's not like I can just get rid of this coping strategy, but maybe I learn a new one.
Exactly. And if you look at, my friend Dick Schwartz, internal family systems, right? They look at this very carefully and they see how your brain's kind of feeling is reacting as if you're stuck back at some earlier point in your life. And it's, when your brain is worried that if you don't turn on these highly critical parts or people-pleasing parts, that you'll fall apart and you'll never succeed and you'll be a failure and everyone will laugh at you. And so poignant, so sad that we do this to ourselves, but we all do in some way, shape, or form, because that's part of being human.
Absolutely. And it sounds like you and I both share a love of Dick Schwartz. He's actually a previous guest. And when I think about Dick and the inner critic that he's helped us really identify more fully and how important it is to see that inner critic, I also think of another former guest of mine, Steve Kerr, who's such a great coach and who coaches with joy and mindfulness, as opposed to, say, you may recall Bobby Knight, who would throw a chair across the basketball court, and how they're both trying to attend. And we all have these on board, these either the kind or the not so kind parts of ourselves. I think that's great that we're able to identify it, because identifying it is half the battle at least. Before I get to my last question, one of the things that may happen as a person, a long-term sufferer of pain, experiences great relief is a mourning, a grieving process for all the years lost to the pain. And I was wondering, how do you attend to the grief that somebody who's now free of pain may experience for the time lost?
So oftentimes there's grief and oftentimes there's guilt. I remember receiving such a poignant email from a guy he was saying, I've been in back pain for 27 years and now I realize that it's my brain. I'm going to be okay. I'll get better. But how am I going to deal with the fact of what I put my family through for those 27 years? Very powerful, very poignant. And the thing is that guilt and grief are signs of caring. You wouldn't be guilty if you didn't care. Look how much caring you have for your family. Look how much compassion and love you have for your family. The grief that you feel for all you've been through, why do you feel grief? Because you care about yourself. At its core, it's self-compassion. And so what I've found is that you can use guilt and grief to help people understand and get in touch with the caring aspect, the compassionate aspect that they can have for themselves and the people around them. And when they do that, compassion heals.
Such a great point in how guilt is so different from shame, as thankfully Brene Brown has been really helping the public understand the difference of guilt as being sadness or feeling bad for something we did versus the shame of feeling bad for who we are, and how the guilt can actually be instructive, whereas the shame, of course, cannot. I'm glad you brought that piece in addition to the grieving process. And there again is another kind of arrow pointing to psychotherapy and psychoeducation around how to attend to one's grief and how we could become better people at the end. I know you're a fan of post-traumatic growth. I've heard you speak about it, and that what doesn't kill us may make us stronger or may not make us stronger depending on how we cope, but we can come out stronger on the other end. And that's very reassuring. I was wondering, as a final question, it's a magical, fantastical one for you, Howard. If you had the ability to confer upon all humanity one insight or skill that would be hugely helpful, what skill or insight would that be? And how do you imagine the individual and perhaps even society might be improved?
Well, obviously, we were just talking about compassion. But in addition to compassion, I think the first thing that would come to my mind would be self-reflection. The ability to stop and just think and look at ourselves in a loving way, a compassionate way, but a reflective way, so that we can see what's happening. And society often doesn't reflect on itself, I don't think, very well, to see what's happening with these, as we started the show with, these soaring rates of pain, anxiety, and depression. These are happening for a reason in our society. And Gabor Mate talks about that very eloquently. And so if we had the gift of self-reflection, I think we'd be a lot better off.
I couldn't agree more. Oh, wonderful. And corroborated by people like Adam Grant out of Wharton, who talks about the idea of thinking again. And of course, Danny Kahneman, who talks about thinking fast and thinking slow and the ability to really introspect and how critical that is in this age where everything's going way too fast. And sitting in great appreciation of you, Howard, who embodies what a doctor can be at his or her best. You are dealing with patients, and I believe that the root term, according to Irv Yalom, on what a patient is, it's one who suffers. And you are kindly, lovingly attending to their suffering. And to your point earlier that you have to care, that you have to have kindness to attend. It comes through in all of your work, all of your interviews, all of your writing. In my experiencing of you right now, your patients are so fortunate. I'm fortunate as one who definitely has MBS. And I just can't thank you enough for sharing your wisdom with my listeners.
Oh, I really appreciate it. Would you put that in writing so I can my children?
Absolutely. I will put it in writing, and I will even write it with my space pen. Thank you so much, Howard. And I already feel like I may need to have you back at some point.
It has been a pleasure and an honor. No question about it. Anytime, Adam.
This is Dr. Adam Dorsey thanking you for listening to Super Psyched. If you know anyone who might like it or who might benefit from listening, share it. And if you like the episode, please hit subscribe.